That was The Police with Don't Stand So Close to Me. A reminder that despite the continuing success of the vaccine rollout here in the UK, social distancing will likely be here for some time to come. Hello, welcome to Black Country Week. You're listening to me, Eve Bennett. Just after 11, Ian will be talking to Andy Street, the Conservative candidate and current West Midlands Mayor running for re-election in the local elections on May 6th. But for this first hour, we'll be answering your questions about the vaccine rollout with a panel of experts who are here now. If you'd like to introduce yourself, starting with Ruth, because you're in my top corner.
Hi, thanks, Eve. It's lovely to be here. I'm Ruth Edwards. I'm a GP in Brierley Hill, and I'm also the clinical chair for Dudley CCG, Dudley Clinical Commissioning Group. Thank you.
And Karen?
Good morning again. Really pleased to be here. It's great for you to be hosting this for us. So I'm the Director of Public Health for Dudley. So I work for the council, but I'm there on behalf of Dudley residents. Thank you.
And Mo?
Hi, I'm Mohit Mandarata, a GP working in Hales Owen and also work for Dudley Clinical Commissioning Group. Thank you for having me on.
And finally, Hitesh?
Hi, my name is Hitesh. I work as a pharmacist within general practice in Dudley, and also as prescribing advice for Dudley Integrated Health and Care Trust.
So we thought it would be best to start with an overview of the vaccine rollout for our listeners listening in Dudley. So take it away.
So I think I'm starting with this, Eve. So I'll just tell you a little bit about the vaccination programme in Dudley. And first of all, just to make people realise how important it is to have this vaccine. It's for two reasons. It's to protect you as an individual, and it's also to protect other people as well, so that we reduce transmission between people. So there's three ways of getting the vaccine in our area across the Black Country and West Birmingham. We've got the vaccination centre at the Black Country Living Museum. There's another big centre at Tipton Sports Academy, and there's a couple of local pharmacy sites in Dudley. We've also got GP-led vaccination services and a hospital hub, Russell's Hall, which is primarily for health staff. Our GP-led vaccination centres are based around our communities called primary care networks, and we've got one of those in Hales Owen, one in Stourbridge, one in Sedgley, one in Kings Swinford, one in Brierley Hill, and one in central Dudley. And the pharmacy sites are both in Dudley as well. So we're doing very well so far, vaccinating across Dudley. As you probably know, we've got cohorts that have been defined by the government, cohorts 1 to 9, and we're currently working on cohorts 6, 7 and 8. So far, people over 55 should have been called, people who originally were on the shielding list and had shielding letters, people who have other clinical vulnerabilities, who are between the age of 18 and 65, carers, and this is our unofficial carers as well, need to be coming forward now. Frontline health workers and social care workers should all have been called for. So if the ways you can book a vaccine are either contact your GP practice if you're unsure which group you belong to, but primarily call the National Booking Service on 119, or there's an online booking link at www.nhs.uk/COVID-vaccination. I'm sure we'll be able to share these addresses. The priority cohort groups have been designed to have the biggest impact on mortality. So that is why we started with this cohorts 1, which was people who lived in care homes and their carers, people over 80. We then moved on to all the healthcare workers and people over 75. Then cohort 4 was the over 70s, cohort 5, the over 65s. And as I say, we're predominantly dealing at the moment with catching up with the over 55s and over 60s, and people that have these clinical health problems. We can go into more detail as to what those sort of health issues are in the questions section. But yeah, hopefully we've covered most frontline health and social care workers who are at the biggest risk of mortality. The Black Country Living Museum and Tipton are mainly focusing on cohorts 7 and 8, which are the 55s and over. The GP practices are concentrating on people who have the health conditions. And really that's the people who in the past have probably been called for a flu jab. They tend to be our patients with the highest risk. And also our patients with learning disabilities are generally coming through the GP route. Figures wise, we're doing really well. The latest published figure was 427,000 vaccinations have been given across Black Country and West Birmingham, so we're getting close to 500,000. And in Dudley, 91% of the over 60s have received their first dose of vaccine. So it really is fantastic coverage. People are working really hard to get really good coverage, and we're doing very well. There's now talk of the second doses, because it's really important that everybody has a second dose to improve the effectiveness of the vaccine. So the GP-led services are beginning to schedule their second doses of both vaccines. Again, we can talk about the different vaccines if people want to in the question and answer session. But the residents and patients who had their first vaccine in early January will now be at the point of being ready to receive their second dose, and will be called for very shortly. But most people for second doses will be waiting for contact from their GP surgery for that. We've got a lot of communication work going on across the Black Country, this being one of the opportunities to engage, but it's very important that we have these opportunities so we can address the myths particularly associated with the vaccine, so that we can increase uptake. So we're working really hard with Karen and her team in public health. We've got community champions, we're working with faith communities. We've got various tools now so that we can monitor uptake and look at and analyse the data so that we can see where we need to target future vaccine programmes. So yeah, everyone's got a role to play, and we're very grateful for the support that you're giving us, and any support is welcome. I think I'll pause at this point, because I want to have the opportunity for my fellow panel members to contribute. So shall I pass back to you, and we'll take questions, and we'll divide those as we see fit.
Yeah, absolutely. Thank you so much for that overview. I think that's given a really, really good insight into the current situation. I've got kind of a list of common questions that come up quite frequently amongst members of the public. But as I said earlier, if you are listening and you would like to submit a question, we are streaming over on Twitter, on our Facebook page, on our YouTube, or you can tweet us at WeAreBCR or text your message beginning with BCR to 64446. So I suppose my first question would be, and as you said, like, please, all of the panelists just feel free to answer whoever feels like they're best equipped to answer the question, is how is the local rollout here in Dudley comparing to other areas of the Black Country and the West Midlands and the UK as a whole?
Is that a question for you, Hitesh, do you think?
Yeah, I can just give you an update on that. So, certainly in terms of vaccination within the Black Country and West Birmingham, we're doing really well. I think there was a message from Matt Hancock just a few weeks ago, just praising the sort of efforts that we've had in Dudley in general around vaccination uptake. We've got a really coordinated effort, collaboration between, as Ruth has mentioned, between our primary network sites, Black Country Museum, and our community pharmacy sites, all offering our local population lots of opportunity to come and get their vaccine. In comparison to the national figures, we're about sort of 91% vaccinated for the main cohorts that Ruth had mentioned. So we're doing really well. There's still a way to go, and there's still a lot of work to do. And we know that there's some communities that we need to reach out to as yet. So that's some ongoing work that we need to sort of continue with. But you know, we need support from the communities and some community leaders to actually go on and do that. And the other big thing I'd say is actually around, this is only, you know, the beginning of the campaign. We are looking at obviously planning second doses, which are really important. And people shouldn't forget that this is only half the sort of campaign that we've reached so far.
Fantastic. And I'm going to come back to the rollout if that's okay. But we had a lot of questions kind of surrounding the vaccine itself and sort of what vaccines are on offer and the side effects, etc., etc. So I suppose that would be my first question actually, is if you're going for your vaccination, if you're called for your vaccination in Dudley, what vaccinations are on offer? What can they expect when they turn up for their appointment?
Mo, do you want to take that question? All right. Yeah,
I can take that one. I think there's There's a couple of things I'd say for that, if that's okay. I think the first thing to say is whatever vaccine you're offered is extremely effective. It's extremely safe. It's gone through rigorous trial processes as any medicine or vaccine would. So whatever you're offered, please take up that opportunity to have the vaccination. We're not offering a choice of vaccination at the moment. Obviously, the government's providing us with deliveries of vaccine, either at the primary care sites or the mass vaccination sites or the couple of pharmacies that Ruth has mentioned. And yeah, whatever vaccine comes into the in our buildings, we're doing vaccinations at our practice in Halesowen. That's what we'll distribute very quickly, effectively. It's very safe to come into the practice and have the vaccine done. From a national perspective, there are 3 vaccines, if I'm not incorrect, Hitesh, correct me if I'm wrong, that have been approved by the MHRA, which is the Oxford Astrazeneca vaccine, the Pfizer vaccine, and also the Moderna vaccine. But on the ground, the 2 that we've had in our practice, and I believe locally and actually nationally, are the Pfizer vaccine and the Oxford Astrazeneca vaccine. The vaccinations can cause side effects. Side effects aren't common. You know, we've got nearly probably 25 million vaccines we're approaching now nationally, and the reported side effects and serious side effects are non-existent. Mild side effects do occur, but they can occur with any vaccination or any medicine. The sorts of things that have been reported are headaches, nausea, feeling a bit tired, feeling a bit hot and cold. Generally, that lasts 2 or 3 days and settles itself with simple supportive measures, rest, paracetamol, fluids. That can happen after any vaccine, even a flu vaccine, and that's your body just building up an immunity to the vaccination. So yeah, generally, I'd just reassure everybody, I've had my vaccinations. I am sitting here and I'm absolutely fine. So, and as I'm sure almost everybody else on the rest of the panel has as well, my parents have had their vaccine. So the vaccine is extremely safe and extremely effective, and it is our way out of the difficulties we've been in the last 12 months. So I'd really encourage people to get it done and not read too much into any myths or misinformation. And if they do have questions, you know, we're more than happy to have conversations with our population, our communities, to try and address any concerns they have to make sure they have the vaccine.
We have actually had a question on our Facebook stream to do with the side effects of the vaccine. Theo Featherstone has asked, do people tend to have a more severe reaction to the second dose than they do to the first, or does it vary in person to person?
If you're happy, I'll take that as well. I think there's no hard and fast, because a lot of people will have, or the majority of people will have the vaccination and not have any side effects. A few may have side effects. Yeah, there isn't a hard and fast as to whether the first dose or the second dose causes more of a side effect or not. But, you know, generally, as I said, they are extremely mild if you do have side effects, and it's, you know, 48, 72 hours at most, and then you feel right as rain again, and you're over time protected, which is great, and which is what we want.
And some people are understandably concerned about the risk of perhaps more severe side effects. So what is the likelihood of having a more severe reaction?
It's extremely rare. I haven't got any specific figures. I don't know whether Hitesh has, but it is extremely rare to get a serious side effect. As far as I'm aware, we've not had any major issues in any of our Dudley sites at all. It has just been a standard local reaction. Some people might feel a little bit off, even in the vaccination site, but we have a process of monitoring people within the sites. So if I can just tell you a little bit about the sites, actually, 2 of our GP practices are doing them through their GP practices. Other areas are using community sites and church halls, but we have all even if it's a church hall or a community centre, everything is kitted out with medical equipment and drugs if anyone were to have an allergic reaction, because obviously we've got to be prepared for it. But as yet, we've not had to use anything other than give people a biscuit and a drink if they're feeling a little bit unwell. People that have had the Pfizer vaccine, that was the first one that we received, and this is the one that's a little bit complicated in that it's got to be kept in very cold storage, and we have to use it within 3.5 days of receiving it. That was the one there was initially a little bit more concern around with side effects and allergic reactions. So people that have had that vaccine are asked to wait in the centre for 15 minutes before they go home. And with our other vaccine, the Oxford Astrazeneca, if people are driving, then we ask them to stay for 15 minutes as well. Just if anything were to happen, we wouldn't want that to happen while they were driving. So we have a process of observing people for 15 minutes in the centre where necessary. But yeah, serious incidents, very, very minimal.
I'll just add to that I'll probably echo that in that we've seen, we've given thousands of doses of vaccines at all of our PCN sites, our GP sites, and at Black Country Museum, and we haven't seen serious reactions to these vaccines. The technology behind the vaccines is tried and tested, and although there were some initial concerns around the Pfizer vaccine and allergy risk, over the time we've been using them, some of those concerns have been far more relaxed. So we know more about them. We're learning all the time. And people should be rest assured that we're monitoring things very carefully. So any concerns that are raised, everything that is raised is carefully monitored and reported, and that information is collated nationally. So any serious concerns that we'd know about, we'd get wind of very quickly. And again, our protocols in those sites that Ruth had mentioned are very strict. We talk to patients about the vaccine, the side effects, who's suitable, who's contraindicated. And actually, there are very few contraindications to these vaccines.
So that actually leads me on to my next question is, are there groups of people who aren't suitable to take these vaccines? People have raised concerns, for example, about pregnant women, people trying to conceive. Are there groups that can't take them?
So if I can come in there, I think the only group that we would be very cautious with are people that have had an anaphylactic reaction previously to a vaccine. And that's the only group that we would be particularly cautious with. And an anaphylactic reaction is a full collapse type of reaction. So not just a little bit of redness or achiness around the arm or a rash, a full collapse, call an ambulance type of reaction to a vaccine. And actually there's very few of those people around. So otherwise it is a very safe vaccine. Yes, you're right to raise the question around fertility and pregnancy. Because obviously we'd like to do as much research as possible on all of these, any new drug and any new vaccine before we would recommend during pregnancy. So we're still waiting for the more long-term data to know exactly about the safety. But at the moment, we don't feel that there is any risk, certainly no risk to fertility and no risk in pregnancy. And actually in some situations, we would encourage pregnant ladies to have the vaccine, particularly if they were in a high risk group themselves, because the risk of COVID and getting the illness is worse than the potential risk of the vaccine.
There's been a story in the news this week about the fact that some European countries have suspended the use of the Oxford Astrazeneca vaccine after cases of blood clots in people that had the vaccine. Is there cause for concern here? Should people be worried?
I'm happy to take that if that's okay. I think, as I said, we've done so many doses here and there's been no increased risk of clots that's been shown from the evidence we have here. I think the important thing to remember is there is unfortunately a baseline risk of blood clots, thrombosis happening in the community anyway, even more so in older populations, less mobile populations. So regardless of having had the vaccine, unfortunately, blood clots do occur and we treat them. I think, all the evidence suggests that the vaccines do not increase that risk of having a clot. So, there's no direct link between the vaccine and having a clot. And actually, the World Health Organization has promoted that actually the vaccine should be had. There's nothing to worry about. The European Medical Health Regulator has also said that countries should not stop using the vaccine, and certainly here we've got no cause for concern in that perspective. So I'd like to reassure people that there is no increased risk of clots with the vaccine. And as Ruth mentioned, fertility, there's been no evidence that it does affect fertility. And even from a pregnancy perspective, in some situations, it is fine to have the vaccine. Obviously, we'd have a risk-benefit conversation with our patients about that, but there are pregnant women in our communities who've had that vaccine. So again, I would just really reassure people that they shouldn't read too much into these articles. And a lot of evidence and research is behind what we're doing. As I said, 25 million nearly vaccinations is such a real bank of evidence that we have as to how effective and safe they are.
I could just add to that point as well that there were people through the trials, women who had the vaccine, didn't know that actually they did then become pregnant, who've been following up, and there's no evidence, again, as you say, of any problems arising. Yet the risks of COVID, actually, we know that they do have, a severe impact on health. So it is about that understanding that we've got really good evidence of the safety of the vaccines, but we've also got really good evidence of the harm that COVID can do. So the more we can build the trust in our communities to be able to take up the vaccine offer, that's really good. If I can just say as well, we've had absolutely brilliant support from our communities, and Ruth mentioned the COVID champions, and there's over 200 community COVID champions in Dudley who've been doing brilliant work, reaching out through a whole range of different networks to help overcome some of the concerns that people can have. And it can be really real practical stuff about, how do I book my appointment, or I'm not quite sure. And if I could just mention one of the other pieces of work that we've been doing with an organisation called Tandustry, who've been helping some of the practices to phone some of their patients and actually have a really detailed conversation, just to get, again, to build that confidence, understand what some of the concerns were, and just to help people make that informed decision. And we've seen a really good uptake. So just wanted to get those points in. Thank you.
Fantastic.
You've got to mention one quick thing about the fertility thing that you mentioned. One of the challenges we have had, and I've been doing some work with the care homes vaccination team, going into care homes to vaccinate. And one of the challenges we have had is some of the younger carers who are working in some of these homes have had some real concerns about fertility risk. If they are concerned, and obviously, speak to the GPs, call them up and have a word with them. We really want to get these people vaccinated, because that's a real risk level, especially in the care homes where our most vulnerable population is. And it is a myth, and there is no link to infertility whatsoever. In fact, in the initial trials that were done internationally, many of those women that were included in those trials have gone on to have pregnancies after that. So, getting that message across, I think, is really important for those social care workers.
We've just had a question in from Craig, actually, on the Facebook stream, who says, I have blood clots and I'm on blood thinners, and I have been for 3 years. And I've just had the vaccine. Will I be safe from getting further blood clots, is what he's asked.
Yes, I would, because he's on the right treatments for blood clots, he should be absolutely fine. We don't think that vaccine is going to increase his risk of blood clots, and actually, because he's on treatment, that reduces his risk very significantly. The medication that people take for blood clots is one of the things we do ask about when we're giving people the vaccine. And it's not a reason not to have the vaccine. It's just we need to know before we give the vaccine, because it just needs a little bit more pressure on the arm afterwards, just so that people don't bleed. So it is one of the questions we ask, but it's not because we're concerned that there's a reason you can't have it.
And one other concern that's been raised quite frequently is the emergence of new variants in the UK, for example, the Brazilian variant, the South African variant. What do we know about how effective this first round of vaccinations are against these new variants? And are there vaccines in the works to protect against these newer variants?
Yeah, I'll start with this, and I think Hitesh might have more information. But yeah, there's a lot of work going on looking at the variants. I believe that the makers of the Pfizer jab and Oxford Astrazeneca are continually looking at this, because they can actually adapt the vaccines over time to be able to protect us against all the different variants. So I think certainly the Kent variant, our UK variant, is pretty well covered by the vaccines, and there's a lot of work going on so that we can make adjustments because of the technology of these vaccines now. They can be adapted quite quickly, I gather just over a period of a few weeks, so that there'll be ongoing research, and over the period of the year we should be able to get really good coverage. Hitesh, have you got more for that?
Yeah, just to add to that, absolutely, in terms of the initial strains of coronavirus that we had, the vaccines are prepared for those particular strains. The Kent strain that we saw subsequent to that, the vaccines are very effective against that particular strain. Where there's lack of efficacy really is around the South African strain, the Brazilian strain. But this is always going to be the case. This is what viruses do. They will mutate to live in a host, and therefore they're always going to adapt. We just need to sort of have the technology to adapt those vaccines accordingly. And that, like as Ruth has said, that work is ongoing. We've got incredible international collaboration around looking at these different variants and how we can manage them. That's also one of the big reasons why we need to still be very, very vigilant about what we're doing, about how these viruses spread. So the guidance around, hands, face, and space, those sort of things are still very relevant, and we need to make sure that we don't forget that those are our key areas in terms of stopping infection spread.
In terms of these new vaccines that will be coming out to sort of protect against the variants, as you said, the virus develops and it changes. How can people expect it to go forward from this sort of when the first vaccine rollout is finished? Will it be a case of a yearly vaccine? Will certain groups be asked for it and others? Will it be similar to the flu jab where people who are more vulnerable are asked? How's it going to look?
I'd say probably quite possibly. I think obviously time will tell, and as always, we've been guided by the science and the experts. Obviously with the flu jab, I think as Hitesh said, viruses do mutate. We know that, and I think in time we'll see how rapidly this virus mutates. We know the flu jab is very quick at mutating, which is why we have a yearly vaccine which sort of is adapted to whatever strain of flu there is, and there is a good chance that a similar sort of thing will happen with the COVID vaccine, whether it's an annual one or 2 yearly one. Obviously, we'll find out hopefully in the coming weeks and months. But I think, again, as Hitesh said, I think partly the most important thing is people do still follow the guidelines. We're all desperate to get to June the 21st, but I think it is a marathon, not a sprint. We need to take that stepwise approach because the last thing anybody would want for so many different reasons is another lockdown. So it's really important we follow the guidelines that are in place, the hands, face, space, limit our contact, just because the vaccine is still rolling out and there are still vulnerable people who aren't protected. The other aspect to it is, even if you've had the vaccine, it does take a few weeks for it to sort of build up the immunity, and you do need both doses for protection. So just because you've had the vaccine, it doesn't mean you can return to, I know we're all waiting for it, but what we'd call a normal life. So just please be cautious. And the evidence we do have at the moment is that the vaccines we do have are effective against the new variants. They may not be as effective, but they do still provide protection. So again, we're reassured from that perspective, but the science and the research is ongoing and will always be directed by that.
Thank you. If I can just add to that as well, that I mean, absolutely, totally agree with everything that's been said. And there is just significant surveillance that's going on all the time so that we can actually pick up if we do get any new variants and then understand what they are and detect them, as early as possible. And I think if anybody, again, just please do keep looking out for signs and symptoms of COVID-19, which we're all very, very familiar with, and we've got access to both symptomatic testing within Dudley, but also asymptomatic testing with the new lateral flow tests that you do yourself. But we've got those from our pharmacists at Saltwell, Dudley Leisure Centre, and that's being rolled out through schools, as you'll be aware. So please, we do urge people, if you get any signs or symptoms, then please do get a test and isolate until you've got the results. And again, we're getting really good compliance of people who have become positive to then actually follow up with the contact tracing. And again, we've got a really fantastic Dudley offer, a great team of local people involved in that work, so that we can make sure that people get all the support that they do need if they do become positive to be able to isolate, be that getting financial or other support. So we do urge you, for any more information, just look at the council website and it's all on there. Thank you.
We have actually just had a question in from a member of the public, Mike Freeman, who says that he and his wife currently have COVID and feel terrible. I know this isn't related to the vaccine, but what can we do to alleviate the symptoms? Is it okay to take paracetamol or Nurofen? My wife feels worse than I do and has a terrible cough.
I'm going to leave that to Mo.
I'm happy to take that. Yeah, absolutely. Paracetamol, rest, plenty of fluids. For most people, a lot of people don't get any symptoms with COVID. Obviously, in this case, clearly they have got symptoms. So they should, there's a lot of information available on the NHS website. Obviously, if there is concern that they're feeling very unwell, very short of breath, then you can always contact 111 for advice. You can contact your GP practice in opening hours for advice. There are lots of centres set up where if they need to be assessed and examined, that can be arranged. Obviously, in an emergency, we'd always recommend people dial 999. So it depends how they're feeling. But yeah, absolutely, the paracetamol, plenty of fluids, rest for most people will be enough. But if you are feeling very poorly, don't hesitate to seek medical advice. I'm
just linking that to the vaccination. We've had some situations where people have had positive cases, and when we've called them for vaccination, obviously they can't come forward for vaccination. So we ask them to wait at least 28 days from the positive test before they come through for vaccination. And that's really only to make sure that they're not confusing any sort of side effects from the vaccine with the infection itself. So if people have been in that situation where they haven't been able to have the vaccination because of positive infection, make sure you do call up for your vaccination.
We'll move on now to talk a little bit more about the rollout of the vaccine. But if anybody else has any questions regarding the vaccine itself, then as I said, do not hesitate to get in touch on our Facebook page where we're streaming this live, or you can text BCR and your message to 64446, or you can contact us on the website at blackcountryradio.co.uk, or even tweet us at WeAreBCR. We'd love to hear your questions. We have another question from Sue Hastings from Hale Zoen. And she asks, when do they expect over 50s to be called up, and when do they expect the over 40s to be called for their vaccination?
I'll come in here for you. We don't know the exact date. As I say, in the Dudley area, we're doing over 55s, but I don't think we're going to be that far away. I know in Worcestershire, they've already called for their over 50s. So I think, you know, hopefully within a matter of a few weeks, we should be ready to call for our over 50s. Once that's cohort 9 and that's phase 1 then completed, and then we move on to phase 2, which is all the other adults that haven't been vaccinated. So basically everyone between 18 and 49. The government target is that all adults in UK are vaccinated by July, I think end of July. But I think we should be on target for that in Dudley, because the rollout has gone very smoothly. We've got a lot of centres all set up, all ready to go. So I would hope in the next couple of weeks for the over 50s, and then probably 2 or 3 weeks again behind that, the next cohort down. Just the other thing to bear in mind though is whilst we're giving all these first doses, we've also got to build in all the second doses as well. So whilst giving first doses to all the younger people, we start on the second doses for all the older people. So the clinics do have to be very well organised, because we have to do separate clinics for a first dose or a second dose, and we've also need to try and align the vaccine. So if you had Pfizer for your first dose, it's preferable to have Pfizer for your second dose, and the same with the Oxford Astrazeneca. So there's quite a few logistics for us to be dealing with in this next part of the rollout, that can be quite complex, but we've got lots of processes in place to try to manage that. But it's going to be busy.
Well, as you said, it's a testament to how hard your team has been working that we've just had a message from Beth from Brierley Hill, who says, can I just say thank you to the Black Country teams? I was hesitant about my vaccination because I'm needle phobic, but the process was so smooth. The way the council and CCG have run this has been brilliant. So thank you. So that's a really nice testament to how hard you've all been working. But for those people that are eligible for the vaccine at the moment, who should have been called up, who perhaps haven't been called for some reason, or are just maybe have changed their mind, they didn't want it and now they'd like to get it, what do they need to do? Where do they need to go to get in touch to get their appointment booked?
So as long as they are in one of the groups that we've mentioned, so 55s and over, got a health condition, been on the shielding list, health or social care worker, and they probably had some sort of invitation at some point, but haven't taken it up so far, it's phone 119, or go on the government website, just Google book an appointment, and it's all linked to NHS numbers. So once you've put your demographics in, even if you don't know your NHS number, if you've put your date of birth in, it will know whether you are in one of the cohorts that is allowed to have the vaccine, and so it will then link you to the national booking site, and you should then be able to book your vaccine at a site of your choice.
And as you said earlier, that the JCVR, the Joint Committee on Vaccination and Immunisation, decided to do it by age. Could you explain a little bit more about that and why they decided against going based on, public people who are working in the public who are more, prone to coming into contact with people who could have COVID, why they decided against sort of doing it by profession, essentially?
I can kick that off if you want to. In terms of risk, the biggest risk of serious disease for COVID is determined by age. So age is always going to be the biggest determining factor here. And the cohorts that JCVI have put together reflect exactly that. So we went to our care homes first, we did those most vulnerable people, we then went into the sort of the over 80s in general practice. Those are the sort of cohorts, and that's how we work through them. We have also vaccinated a number of people in frontline healthcare roles, so they've also been done. And there is some arguments around saying, oh, which other sort of professions should be done. Obviously, when we have people in professions that fit into those age groups, they're also going to be called up, because obviously that adds to their risk as well. This is sometimes also about sort of supply of vaccine. So we need to make sure that we're prioritising the groups where we know we're going to get the biggest health impact. And so there are, there will be some professions where we say, actually, should we vaccinate them before others? It's a difficult argument, really, but I think that the cohorts that we've got in place reflect the biggest risk profiles.
If I can also add to that, I think, as I said previously, we've always been guided by the science, and I think already our regulators have shown adaptability. So as you probably know, a few weeks ago, the shielding list was adapted and changed, and there was an extra 1.7 million people nationally added, which were obviously brought forwards in terms of their vaccination. And that's because the data has shown that things like BMI, deprivation, ethnicity, gender actually play a role in terms of increasing your risk of morbidity, illness, mortality from COVID-19. So that, we may have to adapt things in the future, but as Hitesh said, we've been guided by the science, and it is very clear that age is the biggest risk factor. And I think that's why the JCVI have produced these cohorts we're following in terms of our vaccination rollout.
And if I could just build on that as well, Eve, speed is of the essence here. So the faster we can get this vaccine programme rolled out, the better. And actually the system of doing it by age cohort is by far the simplest. If you try to do it by profession and jobs, it would get so complicated. So by doing it by age, I think we've shown that we can actually get this pushed out really quickly, because it's simple, it's effective, people understand it.
Yeah, I couldn't agree more that the best thing we can do is get it out as fast as we can. And there is an incredible amount of scientific research that, and really detailed work that does support that decision making around the approach that's been taken. So there's nothing more to add, really, but just to be assured it's not it's a really well thought out decision making process that we have there. Thank you.
Of course. And speaking of age, we've actually just had a question in from Martin in Hales Owen, who said, I'm in a lower age group, I'm 25. And I wanted to know whether the panel feel that as we come out of this, the vaccination in future will be offered to those in need for free, but everybody else at a charge with the same model as the flu jab, or whether it might be a case that everybody's offered it for free as they are at the moment.
Interesting question. I'm not sure we'd be in a position to answer that at the moment. I think it will depend on how the infection is transmitted in the future. Yeah, it's interesting, isn't it? Because the flu jab we do just give to certain cohorts, whereas we want everyone to get the COVID vaccine at the moment. But because of the speed it was being transmitted and the way it was affecting our communities, so I think it will depend on how this infection looks in the future before we'll be able to.
Yeah, I think we don't know, but that's not something I've ever heard anything being suggested. And it is it's a worldwide pandemic, so it's really important that we get across the world, that we get as many people vaccinated as possible in a timely manner. So I can't imagine that happening, but yeah, it is an interesting question.
Another question that's been raised is how Dudley, for example, the Dudley Borough, the CCG, GPs, pharmacists, the whole team really are working to reach those people who might not be able to come in for a vaccination. So those who are housebound, those who don't have access to technology, people with learning difficulties, essentially those groups that are at risk of slipping through the cracks.
Let me just start off with that one. So in terms of some of those groups, we've certainly made some real priority groups here. So if you imagine some of the patients who have learning disabilities, we've got a roving team that are going out and vaccinating some of those patients who are in supported living. And that's been a real priority for Dudley. When we had that guidance come through nationally, we mobilised that team to go and vaccinate these people very quickly. There are other cohorts where we've had to sort of look at the data, and I think the big thing about the vaccination program Dudley is we are very data driven in terms of what information we have. So we're monitoring all the practices and what cohorts have been vaccinated at each practice. And by looking at which cohorts need vaccinating, we're then having some little pop-up clinics that we're doing in certain communities. So we've had some pop-up clinics being done at the Greens Medical Centre. I think we've got another one coming up in Lye. So these are really important sort of vaccination sort of clinics that will target certain population groups, and hopefully we can get our figures for those particular groups increased. Yes, Ruth, is there anything else you want to say on that?
No, I think, yeah, we did our housebound at the beginning, who tended to be the older, more frail people. They were done by district nurses teams as part of the roving model that Hitesh has mentioned. But now I think it's the data that we're now able to use that's showing us where the areas are with low take up. And as Hitesh has just said, yeah, there's a pop-up clinic in the Lye this week, and this is the first one that's actually going to be a drop-in as well, so people can go with appointments, but actually it will be available for a short length of time on Wednesday for drop-in, but only for people that do live in that community who are registered with the practices for that area. You can't go from another part of the borough, but it is just to try and make it easier for people, and that would work particularly for people that struggle with the technology or haven't got a smartphone or internet connection. That they will be able to use that centre, and if there's other areas that need that in the future, then we'll be able to adapt to do that as well.
If I could just add to that, that we actually meet on a weekly basis, and we're constantly sharing information. That could be feedback from members of the community, from community leaders who are saying these are the issues in this area. So we're really responding and actually working with them to say, so what is the local solution that we need to do to obviously to build confidence and to overcome some of the really practical issues that have come up for some people not being able to get their vaccine, and that works, is proving really effective, but really flexible in terms of what we do to support people. Thank you.
This actually moves on to what I was just about to ask. We had a question from Mo in Netherton, and he's asked about the risk of particularly the BAME communities being at risk of being susceptible to misinformation, and that's kind of stopping people in those communities from getting the jab. I would quite like to know if you have any figures about how the uptake in those communities compares to other communities, and also, Ruth, I know you touched on this in your introduction, but sort of what the Dudley Borough is doing to reach those communities that might be a bit more hesitant about getting the vaccine.
Yeah, I'd probably like to pass to Mo, because I know Mo's done quite a lot of work on making videos and doing a lot of work in different languages here. So I'll pass to Mo, and then Hitesh, have we actually got any figures?
I've got some figures that date back a little bit sort of into the end of February. And Ruth, you're right, we have got some challenges in some of our communities, but it's not just in some of our BAME communities. I think we've also got some challenges in some of our more deprived communities in Dudley as well. So I think there's some messages that we need to sort of send out, not just to sort of certain communities, but as a whole around sort of vaccine hesitancy, whether it be around concerns around what's in the vaccines, the ingredients, some myths around animal products in the vaccines, fertility concerns that we've already addressed, but also things like, very practical things like when I've been speaking to some of these patients, they've been isolated for a long time in their own homes, and some of them are just frightened to come out to mass vaccination centres. I know Mo's done a lot of work to try and get some of these to these people using local community leaders.
Yeah, I mean, if I can come in on that, I think certainly, we know it's very clear from again the data we have that unfortunately BAME communities are more likely to be adversely affected by COVID, become more unwell with COVID, and we know again from the data we have that they are unfortunately less likely to take up the vaccination. Now, we have been working on this for months now, and numbers are improving, but absolutely there's a lot of work to do. I think there is misinformation out there, as Hitesh has said, which again, there's a lot of information available to challenge some of the myths that are out there. There's nationally, there's a lot of work going on, and locally, we've got mosques that are set up as vaccination centres in Birmingham. There's gurdwaras nationally, there's temples nationally. All religious faith leaders have said the vaccine is safe, it doesn't contain animal products, it's effective. So we would really encourage people to have the vaccination, but I think a lot of it will come to one-on-one conversations, because I'm reluctant to blanket everybody as a BAME community, because some of these, the causes of hesitancy that are out there are very personal. So I think that's where, as GPs, we know our communities. Obviously, there's a lot of great work going on by public health colleagues, and I think often it is about having one-on-one conversations to understand why they're not keen to have the vaccine and try and address the concerns they have. So there isn't a one sort of size fits all reason that people aren't having the vaccination. Locally, we've done a lot of videos, multi-language things. We have got these community champions. In Hales Owen, we've had a lot of great work from our primary care network and local GPs with our Yemeni community to try and get them to sort of uptake the vaccination. Lots of videos with faith leaders showing them having the vaccination. But absolutely, there is a lot of work to do, and we are aware that that's a real area that we need to focus on.
Another question we had on Twitter was about the sort of speed of the vaccine rollout and why the idea of 24-hour vaccination centres hasn't come into fruition yet. I believe the government said that there wasn't really a clamour for these 24-hour centres, but I know many people, if they were called to have a vaccine at 3:30 in the morning, would definitely take it up. So is it a case of, there's not enough supply for that? Is it logistics? What's kind of stopping that from happening?
I think it's a bit of both there, Eve. It's the supply has been difficult. It's although there is plenty of vaccine, it seems to come at sort of quite staggered times, and you don't always know when it's going to be. So it's quite difficult to plan ahead. We're usually just planning a few days ahead at a time. And so I think staffing a 24/7 centre would prove to be logistically difficult, and I think it's the supply of vaccine more than anything that restricts that, plus getting enough staff available, because certainly in primary care we're trying to run the vaccine centres as well as provide our normal primary care as well, and the larger centres are really helpful, and lots of people are being trained as vaccinators that might not have a medical background but have a suitable background. But in the early days, it was very much about trying to get all the centres staffed and trying to get on with our day jobs as well, because we can't neglect primary care and we can't neglect looking after people's long-term conditions. So it's a balance, I think, more than anything.
Whoever is keen to turn up at 3:30, I hope they maintain that keenness whatever time their appointment comes.
That's really good, and I think I think it's worth saying we can't underestimate the mammoth task that has actually gone on, internationally, and I think that actually the good job that is going on in the mass production of vaccinations, which is just, it's unprecedented. So yeah, I'd absolutely echo what people have been saying. I think it's also worth a mention for the volunteers that are supporting the programme as well, in guiding people through the centres, and we've had just a fantastic response within Dudley, haven't we, with support the whole approach to run particularly smoothly across the borough. So thank you to all those people.
We've got sorry, did you want to say something?
Well, yeah, there was just one more point I wanted to get in before we do run out of time, and I meant to talk about it when you were talking about the BAME population. I just wanted to mention Ramadan, because we know that Ramadan starts in a few weeks' time, and that there might be some concern as to whether you can have the vaccine or not. So a lot of people will be having their second vaccines by then, and it will also coincide with first vaccine. But I just want to let people know that getting the vaccine does not invalidate the fast, and Muslim communities are encouraged not to delay getting the vaccine during Ramadan. I think, take your point about the 24/7 centres, that could be really useful during Ramadan if people were wanting to come out of daylight hours. But we'll have to watch this space as to how much that can be organised. But very much want to encourage people to come, and it doesn't invalidate the fast. And there is more information on the British IMA website if people are looking for further information.
Yeah, we are running out of time, sadly. And I had so many more questions I would have loved to ask. But I suppose just before we do, we've got about 1 minute left. If one of you or a couple of you would like to give your final message to the residents of Dudley that might be hesitant about getting the vaccine, why should they come forward? Why is it so important?
We're all reluctant to finish here. As we started, I think the main things are it's protection for yourself and it's protection for other people as well. And I think it's really important to remember that you're protecting other people as well by having the vaccination, because that's what's reducing transmission. But yeah, please let's remember face, space, hands, face, space as well. And we really shouldn't be altering our lockdown behaviours until lockdown is lifted. I think it's really important that we follow both, because the two things together at the moment are working really well to bring down the numbers. So if we can carry on the current good behaviours, get your vaccine, hopefully we can all work together and move to a better place later in the year.
Thank you so much to all of our amazing panelists for coming on and answering our questions. I really hope that was informative for all of you. Don't go anywhere, because just after 11, Ian will be talking to Andy Street, the Conservative mayoral candidate. But for now, here's the news on Black Country Radio.
Live from